We can probably all agree that our current healthcare system often fails to deliver high-quality care and rewards inefficiency. I support policies that will create real incentives for healthcare providers to improve the quality of care they provide to their patients. I'm deeply skeptical, however, of any government initiative that claims it can save 60,000 lives and $35 billion over the next 3 years by improving the quality of care provided to patients. This is especially true for a proposal that relies on voluntary grants to hospitals and other providers to encourage them to modify long-standing behaviors which are often encouraged by current government payment systems. The new Partnership for Patients will spend $1 billion to fund new research at the Center for Innovation at CMS and provide grants to hospitals and other interested parties to reduce the number of patients readmitted to hospitals to treat the same or related conditions. The crux of Partnership Initiative is providing grant monies to encourage providers to do the very things they should already be doing for their patients. While this may be politically attractive because it wins the support of all the stakeholders who will receive grant funds, I see very little evidence that it will actually change the fundamental problems that exist in the current system. When assumptions are given to an actuary, it kind of seems to me like that would be like assuming that I would grow to 6'4" and be able to run the 40 in 4 seconds flat and therefore be a starting linebacker for the Redskins next year. It's not going to happen, and I'm pretty sure that these numbers aren't going to happen. And when they're, especially when they're just based on a couple of assumptions like that. So I want to ask CBO and the CMS actuary to perform real estimates rather than just looking at limited assumptions that would drive an answer. They know the real-world challenges that CMS faces, and they have to take that into account when doing their estimates. And that way we can have a more honest debate about the merits of the program. So I'm going to be writing a letter to the Chief Medicare Actuary, Richard Foster, later today, asking that he provide me with a real estimate for how much money that program will actually save.